Yesterday, we heard that Health Canada has approved Moderna's COVID-19 vaccine. Let's talk a little bit about what the distribution rollout could look like for that. Dr. Isaac Bogoch is joining us. He's the infectious disease consultant at the University Health Network, joining us now to weigh in. He's also a member of Ontario's COVID-19 vaccine distribution task force. Dr. Bogoch, great to be able to speak with you and get caught up with you. We can appreciate how busy you are. Let's first get your reaction. I know that's an understatement, but let's first get your reaction to Health Canada approving Moderna.
It's phenomenal. It's phenomenal news. We now have access to two very safe, very effective vaccines. We're going to watch these roll out. And I really think this Moderna vaccine is a great additional tool because we know it's a bit more stable compared to the Pfizer vaccine. You know, it's still as safe and as effective as the Pfizer vaccine. It's just more portable. So you can really take this vaccine to more rural and remote places. You can take it to, for example, more remote Indigenous communities. You can bring it into long-term care facilities. These are the places that sadly account for about 80% of the over 14,000 deaths that we have in Canada. So there's a lot of good we can do with the Moderna vaccine when we add it to the Pfizer vaccine. And hopefully we get as many doses as possible so we can really start these programs and really, I guess, boost these programs and enhance them and roll them out quicker.
And as part of the distribution task force, give us a little bit of detail and granularity in terms of how this plays out. What's the process here?
Yeah, well, it's interesting because first you have to identify who is prioritized and also where they are being prioritized. So obviously Ontario is a huge place, and essentially there is a system based on data and based on equity to determine who would be the highest priority individuals to be vaccinated. And you know, there's some federal guidance on this, and most of the provinces, Ontario included, didn't veer too far from that guidance. So that's essentially, you know, people who live and work in long-term care, frontline healthcare providers, Indigenous communities, and also people who are over the age of 70. So you're watching most provinces adhere to those federal guidance very, very closely. Of course, the other issue is where. I mean, Ontario is huge. So the higher burden areas are going to be vaccinated first, and we've already seen many centers pop up. Most, not all, but most of them are in the more heavily impacted areas. And these programs are rolling out. We get access now. We had another shipment of the Pfizer vaccine in. We're hoping to get the Moderna vaccine probably in the next couple of days and start programs like that. And based on the properties of these vaccines, we can set up different systems like Moderna to go into the long-term care facilities or more remote communities, Pfizer vaccines basically at a select distribution center to bring people to those vaccine sites.
And how are we prepared in terms of the logistics and making sure we have enough of the healthcare workers to be able to go and do this? Where are we from a capacity perspective versus what the needs are?
Yeah, that's a great point. And luckily, there's this giant team of logistics experts to really sort out how vaccines actually land in Canada, get this workforce in nursing, in primary care, in public health. And I really think that by utilizing the skill set that we already have in the province, we'll be able to better facilitate and more efficiently facilitate vaccine rollout. And you're going to start to see that ramp up as we get access to more and more vaccines.
And I think some people, though, have been a little bit concerned about the rollout of the vaccine, just given the fact that we seem to be a little bit behind as it related to the testing capabilities here in Canada. We've had actually a few CEOs on BNN discuss that. So how do you put us at ease? Have we learned something from how we were testing and the time it took to get tested as it relates to the rollout of the vaccine?
I'd push back on that. If you look at a map of the world and look at every country in the world and which countries are vaccinating, you can still count them on one hand, and Canada is one of those countries. So I think we have to be very clear that of the about 7.5 billion people on planet Earth, there's not many of them that have access to vaccinations, and we're very fortunate that we've started our vaccine program in mid-December, whereas the vast majority of the world, including high-income countries, have not even started their vaccine program. So I'd push back on that significantly, because we have started programs and most people, in fact, almost everyone has not. And not only that, we've now approved 2 vaccines and have access to 2 vaccines. So I think, quite frankly, obviously we want to do this in an expedited manner. But when we sort of look at everyone else in the world, we're doing very, very well.
Okay. Well, that is great to hear. We so appreciate your time. I know how busy you are. So thank you so much for being with us, and happy holidays. Merry Christmas to you and everybody. Stay safe.
Be well. Stay safe.
Thank you. That is Dr. Isaac Bogoch.